Hello. My research question is, in what ways does lack of transitional living services contribute to homelessness, mental health issues, and substance abuse among young adults who age out of the foster system? The research method that I chose will be a mixed method approach. The social problem issue is that inadequate provisions of welfare services to assist young people in their transition to adulthood can result in significant issues such as homelessness, mental health challenges, and substance abuse. Without stable housing and support system, these individuals are at greater risk of experiencing homelessness, which can further aggravate their mental health difficulties and increase the likelihood of substance abuse issues as they navigate the complexities of adulthood. This situation continues to cause generational trauma as the cycle of dysfunction continues due to insufficient welfare services for youth who are not being reunified with their families and are seeking permanency within the system. The sections that I included in my introduction would be the background and the significance of the social problem, the research problem, and my research question. The problem statement, the background information of the social problem. The client group consists of the young adults who have recently or are about to exit the foster care. This population lacks safe and stable housing options due to limited resources after leaving foster care, especially if they've never established permanency during the time in their foster system. This population is at risk of homelessness due to housing instability. This population may also be facing mental health challenges or substance abuse issues, which are often exacerbated by homelessness. So this population who is particularly vulnerable might, during their being in the foster system, they might have not been stable due to mental health issues that have never been addressed. So they weren't able to reach permanency or have stability because of their mental health was never taken care of, or at least never stabilized. So throughout their years in the foster care, they never reached that. So when they transitioned, they really weren't able to transition. They continued staying the same. It made it more difficult for them to navigate adulthood. Research question, as I mentioned, in what ways does lack of transitional living service contribute to homelessness, mental health issues, and substance abuse among young adults who aged out of foster youth system? So basically, the welfare system does not prepare the foster youth to transition to or to be confident and stable to be able to navigate adult when they age out of the foster system. Literature review shows that homelessness among age out foster youth shows that 20 to 50% of foster youth experience homelessness within the 18 months of aging out. The contributing factors include abrupt transition at age 18 or 21 and a lack of affordable housing, poor job awareness, and lack of a family safety net or the support system. Regarding mental health outcomes, studies have shown that foster youth aging out show higher rates of PTSD, depression, anxiety compared to their peers. Once youth leave the foster system, access to mental health services typically drops sharply. There is also an elevated risk of substance use disorders, which is more prevalent among foster youth post-emancipation. These factors include trauma history, peer pressure and unstable housing environment, and self-medicated or, as I mentioned, untreated mental health issues. Preventive services are rare for this population. Most transitional programs do not adequately, even the transitional housing programs that we have, which is very minimal, they do not provide the skills that they need to navigate adult. A lot of these programs are not equipped to provide those skills after they transition the foster system. There's a gap. There's also a gap in longitudinal outcomes beyond age 25. So after 25, the transitional housing programs stop for these youth. And so the gap also in this study, they stop tracking youth in their mid-20s, leaving a gap in understanding the long-term effects of aging out without the support. So I would love to explore that area that research is lacking. The theory that's relevant to my research question is the Bronfenbrenner's ecological theory. This theory emphasizes the interconnectedness of various environmental systems that influence a young person's development. In the context of youth aging out of the foster, this framework illustrates how the absence of transitional living services, part of the macro system and ecosystem, impairs these youth's ability to successfully navigate their microsystem, which encompasses family, peers, school, and work. As a result, they may face challenges in areas such as education, employment, housing, and social relationships. The data analysis. The software that I would include in my research study would be for the MAXQDA, which is able to translate both quantitative and qualitative research data. This enables the integration of both data analysis. The software enables users to import and manage various types, including qualitative data such as interviews, surveys, questionnaires. The independent variable of my study would be the lack of transitional living services. This is my primary independent variable, reflecting the level of access to transitional living for youth aging out of the foster. The way I would measure it, this would be categorize variable classification individuals into groups based on their access to services, which is receive no transitional living services, receive limited services, and receive comprehensive services. The independent variables would be the homelessness, would be the mental health, and substance abuse. The stats that I would use would be the ANOVA and the MAXQDA stats. The method that I chose for my research study is the mixed methods, as it uses both data, the quantitative and the qualitative. This research is important because the research is crucial because of the focuses on the vulnerable population that faces significant challenges in navigating life due to lack of support. Youth who age out of foster are at higher risk for homelessness, mental health issues, and substance abuse compared to their peers. This transition out of foster care without adequate support can be particularly detrimental and potentially leading to a downward spiral into these adverse outcomes. This situation may contribute to the ongoing homelessness crisis that we see today. Furthermore, there is an issue of generational trauma perpetrating a cycle of dysfunction. So it's a cycle that will continue, and we won't be able to cut the chain due to lack of preventative services. So all the kids in the welfare system that we are failing to provide the adequate services that they need to equip them to the future, to adulthood. This population will end up being the homelessness that we see right now, unfortunately. So the recommendations that I'm giving, there are several recommendations, interventions, and quality of care measures that can be implemented for this population. First is early intervention is crucial. It's important to prioritize the early identification of children and youth at risk within the foster care system to provide timely support and prevent the escalation of mental issues and adverse life outcomes. Secondly, the holistic approach should be adopted. This includes implementing interventions that integrate housing, health, income stabilization services to address interconnected issues of homelessness, mental health, and substance abuse, and to prevent the families to come into the system. To try to, provide services in the community, such as parenting classes, to connect the families to the community for resources, proactive approach that could prevent the family from being separated and causing these chains of events. Lastly is coordinate to promote the collaboration between federal agencies, states, and local governments and organizations that provide services to homelessness youth at risk and their families. And that concludes my research. Thank you.